My name is Tanya Smith, and for my LUT presentation, I will be explaining what a cochlear implant is. This is my visual, and it's the anatomy of the human ear. In order for me to explain what a cochlear implant is and what it does, I first must explain the functioning parts of the ear. There are three parts. The anatomy of the ear includes the external ear canal, which collects sounds into the ear. The middle part includes the eardrum and three small bones, which are the hammer, anvil, and stirrup. The eardrum turns the sound into vibrations, and these vibrations are moved into the third part of the ear by the three little bones. The third part of the ear is called the inner ear. Here is where the cochlea and the auditory nerve are. The snail-shaped cochlea is filled with fluid as well as lined with sensitive hair cells. When these sensitive hair cells they aid in the process of a person's hearing. When the sound vibrations reach the cochlea, they are then it causes the fluid to move, which makes the hair cells move. And these hair cells are responsible for translating sounds into electric sounds. These electrical signals are then passed on to the auditory nerve, and the information is sent up to the brain. Once these hair cells are damaged, a person's hearing is affected. Now I'm going to explain how a cochlear implant works. There are two parts to it. First being the speech processor, which is worn outside of the body. It has three parts to it, which are the microphone, the speech processor, which you can see better here, and the transmitter. The second part is the receiver, which is surgically implanted under the skin, and it includes an electrode coil that reaches the cochlea. The way the cochlear implant works is that the microphone picks up the sound, and then these sounds travel down a small wire into the speech processor where the batteries as well as the computer chip are placed. Right here it turns these sounds into electrical sounds, and they are sent up to the transmitter, which then sends the information over to the receiver. These sounds are then, they follow along the electrode coil, which reaches the cochlea. Here the electrical signals are placed into the auditory nerve, and the information is sent up to the brain. Lastly, I am going to explain the surgical process of receiving a cochlear implant. What the doctor does is he cuts open a 4 centimeter flap of skin, and he will drill a 2.2 centimeter hole into the temporal bone of the skull. He then will drill a second hole about 0.5 to 1 millimeter away from the first hole, and it is about 9 to 11 millimeters deep, and it is at an 80 to 90 degree angle. He then inserts the coil, which has about 8 to 10 different electrodes on it, and he anchors these down into the cochlea, and he will anchor down the receiver into their places. After he is done, he will pull the flap of skin back over the receiver and stitch it back up. For the next 48 hours, the wound is left alone to heal, and 1 to 2 months later, the patient will come back and the processor will be fitted. They will get a new processor, and the implant will be turned on for the very first time. Are there any questions?
How much does a cochlear implant cost?
The cost of a cochlear implant costs dramatically from $50,000 to $100,000. This includes the evaluation, the surgery itself, the outer device, hospitalization, and rehabilitation. Some or all of this can be covered by your health insurance.
Will the person's hearing be normal with a cochlear implant?
A person who has a cochlear implant will not have normal hearing. A cochlear doesn't give a person normal hearing because it sends sounds to the brain in a new electrical way. The sounds bypass the middle ear or the inner ear, and the information is directly sent from the auditory nerve straight up to the brain. Sounds will be heard differently compared to a regular person's hearing.
Can the person get the cochlear wet?
A client who has a cochlear implant as of right now cannot get their implants wet. This includes such activities as swimming, bathing, or even activities or sports that may cause them to sweat a lot. But due to recent advancements in technology, it looks like in the future clients will be able to get their implants wet. Thank you.